Good afternoon. Welcome to another session live with me, Vinod James, with Neethu's Academy Reading. So, how are you all? What are you all up to? Are you all eagerly waiting as we all are? Every time when that live session comes in, we're all eagerly waiting to see how many of you are there, how many of you are, like new, how many of you are already been there, how many of you have known people. So it's an absolute, enthralling session every day because you make that happen. So yes, as students are getting in, I can see that there are lots of new names which always pops up, but nobody have told me as such that they are all new. Revati Sharat, good afternoon. So very good afternoon to all my lovely students. And also please be kind enough to let me know if you are new as well. Okay. Siminibu, good afternoon. See again, a lot of Marinomen, good afternoon. Sonia Glaren, good afternoon. So if you're new, because why I keep on asking, it's to make sure that you start. Ginny Matthew, good afternoon. Good afternoon, good afternoon. So if there is anybody who's attending for the very first time, please do let me know because that's just to add to my known people. Okay, I am so happy to say I know people across this place, this place. Soumya Shijo, good afternoon. Lina Joseph, good afternoon. Ashwati Kartika, good afternoon. So good. Happy to see all of you. Known, mixed with new names, as always. Jasna, good afternoon. Happy to see you. Happy to see you all as well, Jasna. So why I keep on asking? Because you have just pinned our official Neethus Academy Telegram page. Okay. Akshara Arun, good afternoon, so that you will not fall for any other group. Rijul Rekha, good afternoon. So just click that. That's a free group again. And if you're not, we have only two groups, okay, in Telegram. One is the one which we have just pinned, and the other one is an exclusive reading Telegram page. That's the only thing that we have. Okay. So Joby, good afternoon. You're all able to hear me, isn't it? Your response is a bit slow, so I don't know whether are you able to hear me or not. Yes, are you all able to hear me? Just give me a thumbs up if so. Yeah? Yes or no? I hope I'm audible to all of you. So what do we do with Neethu's Academy? Neethu's Academy is always there. Okay, Joby is saying yes, Lynette is saying yes. Okay, thank you very much. Good enough. Happy to hear that because the response was a bit slow, so I thought maybe you're not able to hear me. Akila Ajit, yes. Sonia Glarin, yes. Jesna, yes. Good. Thank you. So, Neethu's Academy, Soumya Shijo, yes. Neethu's Academy has regular batches as well as crash courses. That's with the same material that what we are doing. I mean, the exam that we're doing. And apart from that, we have other linguistic exams that we give training as well. So if you want to get more insights, we've just posted a number which is always scrolling on your screen. Please do contact and you will be able to get to know more details about it. Okay, and as you can see, our next batch that the available slots are only from June, July, August, and that is also closing no sooner. Okay, because that's how students trust us, and we always believe in between the trust that you give us. Okay, you take all the very same page that you're watching, the number of followers, it is all because of your trust. The number of followers that is there in our channel that was there, again, it is your trust. If you go look into the Telegram page that you're watching, it is also, we are always on the pinnacle. That's also from your trust. Now, the only thing that we miss is the number of shares that you do. Okay, so that is the only thing that we request all of you is to just share the very same page that you're watching because see, every time when you share, okay, please do understand it's about impacting another student. There are n number of students, Roshna Rose, good afternoon, who still doesn't know that there are free classes, not just reading. Okay, see, please do understand, we're not just only focused on reading. if you really look into, we are coming in front of you with listening. Chris sir every day comes in front of you with listening classes. So if you want to get more insight about it, please do pop in. Ambili Jinu, good afternoon. Dina Besu, good afternoon. If I've missed any one of your names, please don't take it personally. It's just because that I'm adding on to the information, I might miss few names. Shiba, good afternoon. Lee Jalasar, good afternoon. So, and on top of that, every day we post grammar challenges and any new thing that we want to let you know will be coming in that pages. So, Vidya Sijan, good afternoon. So, if you share what happens, it's see, we cater for across the globe. It's not just about one particular people we do. We want to be that bridge between you and your dream for each one of you. Vinita Renu, good afternoon. Shejish Shalish, good afternoon. So again, lot of new names. Is there anybody who's attending for the very first time? Anju Vaisha, good afternoon. If so, please do let me know you are attending for the first time and where are you from? Because that is also another thing why I ask is, see the students in front of you, even though you don't see them, you have to really understand that these are all students across the globe. Okay, we have students from Philippines, we have students from Africa, we have students from Nepal, we have students from Australia, we have students from Israel, we have students from New Zealand, we have students from UK, we have students from Ireland, Sri Lanka, Maldives, you name the country. So it's a international classroom that you're sitting just to make sure that all of you rejoice it. So you have to enjoy. Okay, I'm sitting in a international classes, and that should give us a bit of a morale booster. So every time when I come in front of you, I always think like that. Okay, I'm coming and talking into a international class, which makes me more proud about coming in front of you. Merlin Siju Abraham, good afternoon. Neethu Binoy, good afternoon. So what are we going to do in here? We are literally going to do two things. One, we'll be talking about a part A question, which I've already shared. And the other one is a part B question, which will be shared no sooner. Okay, so that is how it is. So how many of you have already shared? So I request all of you to share the very same page in your social media. If you could, yeah, please, it's just a request. Why? Because we want to make sure that we reach more and more people. Sapna Damodar, good afternoon. So are you all ready for today's session? If so, give me a very quick thumbs up. And we'll be straight on to the material. How many of you are ready today? Yes, all of you are ready? No? Nobody's ready, is it? I can see few thumbs up coming. Lynette is ready. Okay, very good. Good. Chestnut is ready. Excellent. Those are all profound names, which I know that they will always comment. Simi, Ambili. So I want all of you to comment. Sonia, Glerin. See, you have to comment. Merin, I'm ready. Okay, very good. Anshu Vaishak, ready. Okay, good enough. Vidya Shijin, ready. Good. Akhila Ajit, ready. Keep on commenting. Yeah, that makes you more. See, Lija Razar is ready, and Lija Lasar, if you really look into, there are lots of emotions on the side. Heart, the person who have shared a lot, the flag. So this is how we gauge on the aspect. Sapna Damodar, yes, Libal has been ready. Soumya Shiju is ready. Anuel Dos is ready. Revati is ready. Shalji Shalish is ready. So there are few names where there is no such kind of symbols there. So if you have not yet subscribed to our channel, please do subscribe. If you have not yet liked our page, please do like our page. If you have not yet followed our play, please do. Okay, because your support is a highly valued thing for us. So as you have said, you are all ready. Let's go into the first question, and the question would be shared more sooner. And once the question comes on the screen, we'll have 2 minutes to do. Okay, do finish it on or before that. If you have not, try to guess an answer as well. And please do validate by telling what is your answer. Now you have the question and the time is also there. Please do complete and then we will discuss. Well. I could see two people telling me that they have done on or before time, Ambili and Soumya Shicho. I hope others have all done. Have you all done? You got the answer? Jessna Noble done. Okay, fair enough. Three people. So I hope all of you have got an answer. Now, when you're doing, Shruti is saying, done. Okay, fair enough. Now, when you're doing part B, which I have always repeated, but I always believe repetition is the mother of learning. So again, I'm going to repeat, when you're doing part B, you're expected to read the question first, underline the keywords in the question, understand the question. After that, you can do search for answers. You can either read the answer option and then pick it up from the passage, or you can read the passage and then pick any of the three answer options. The safest and the sweetest method is called elimination method. Okay. Now, when you're doing on the aspect, what to do? As I've told you, you're going to read the question. So reading the question means the question is very simple, isn't it? As per the case study, pick the right statement. So very simple. You are expected to pick a right statement from the given passage. See, part B, students are always making it a bit complex on the aspect. Why? Because they are trying to predict the answers. See, predicting answers is not in part B. Part B, you are expected to find the answer from the given paragraph. That means it should be mentioned in a paraphrase form. Understood? That's the difference between part B and C. Major difference. Now, if you really look into the question, so you are asked, read the three options, then see which one has been mentioned there, and they would never give the answers as straight. They will always be in a paraphrase form. So almost I could see a lot of people have said done. So I'm happy that a lot of people have responded to what I've just said. And that's the beauty of coming in front of all you lovely students, because the way that you respond is absolutely tremendous. Now, shall we go and see the question? The question will be coming onto the screen. So as I've mentioned, the question is saying right statement. What is the right thing that has been mentioned from the given paragraph? Now, if you really look into the options, option A, okay, which I always follow, because I always read the question, underline the keywords in the question, then I go to the answer option, underline the keywords in the answer option, then only I go to the passage, because I want to know what I'm searching for. If you're the other way around, no problem. Okay. Now the question is clearly saying, I'm sorry, the answer option A is clearly saying the baby was born with the infection. So clearly, baby, born, infection, those are my keywords in the question. Okay, don't worry, the question will be coming in front of you. Option B, the infection surfaced itself when the child turns 1 year and 6 months. So infection surfaced, that means automatically came when the child turned 1 year and 6 months. Was it mentioned in the paragraph? Or option C, the child was normal at the age of 1 year and 6 months. So 1 year, 6 months are there in two. The other one is it was born. So that means it had from the time the child was born. So this is how you look into and start comprehending, understanding the gist about what you have read. Now, because you have the question on the screen, can you tell me what are your answers and where you got the answers from? I want all of you to comment. I am expecting all the 50 who's there in front of me to comment. I want each one of you to comment what is your answer. Let's see. Let's see how many of you are courageous enough to come and tell or accept in front of a public saying that I got this. Shruti, the first one to say A. Jobia, A. Okay. Vidya Shijin, A. Siminibu, A. Okay. Lija Lazar, A. Shruti Vigil, prenatal infection, okay, fair enough. Rakshit Shetty, a new name, Rakshit. If you're new, please do let me know where you're from. Soumya Shijo, A. Sonia Glarin, A. Ambili Jino, the first person to give me a detailed way. A from the fourth sentence. Excellent. Vidya Shijin is saying A from the second line. Anju Vaishag is saying A. Anuel Dos is saying A. I told you, I want to know where you have got the answer from, because we in Neethus Academy always mold on the aspect of coming and making yourself correct from the mistakes that you have made. Okay, I got a different answer. Liba is saying B. Okay, fair enough. Shibina A. Rekha Manu A. Roshna Rose A. Anu Anil B. Okay, Ashwati Kiran C. Now I am happy. Why? Because A, B, and C is there. Vinita Renu A. Rekha Naresh A. Excellent. Just now I got B from 5th, 6th, 7th line. Very good. The child presented with petechiae during birth and presented tachypnea. Okay, fair enough. Rakshit Shetty, I'm from Karnataka. Very nice. Which part of Karnataka, Rakshit? Lija Lazar leads to infection. Fair enough. Anju, third sentence A. Revati A from first two lines. Fair enough, fair enough. Sapna Damodar B. All right, now it's a mix. Baby birth weight only 1260 gram, not kg. My word. 1260 kg is a huge weight for a baby, isn't it? I know it's a typo, just to make sure that we understand, we realize that there are times where we might make some such kind of mistakes as well. Now, okay, few of you have said Shiba is saying A. So the answers are A, B, and C. Now, always understand the question is asking you which of the statement is right. Now, the baby was born with the infection. Udupi. Okay, I had students from Udupi as well. Good enough, good enough. Very known place for its food, isn't it? Good. Geetu Srinivasan, A. Pratiksha Deepu, A. Right. Now let's go and read. I have read the three answer option. Now I'm going to read the case study. So case study. The mother of the other patient was a white 30-year-old housewife. This was her second pregnancy. It was planned and there had been an infection during prenatal and she had been carrying twins, but one fetus died. So she's having infection during the prenatal phase. So, okay, let's say delivery was vaginal, that means normal. Birth weight was 1260 gram. Gestational age was 38 weeks. SNAP was 0. Sex was male. That means these are all talking about the kids also. The child presented with petechiae during birth. Persistent tachypnea. For several days. At 1 year and 6 months, still excreting CMV in urine. So at 1 year and 6 months, still excreting with urine CMV, that is cytomegalovirus, that is virus related to herpes virus during infection or group infection, had normal neurological development for his age. His sight, hearing, examination finding was normal. Now, it's clearly stating that the baby was born with infection. Why? The child presented with, that means it had petechiae. What is petechiae? Pinpoint, unraised, round spots under the skin caused due to bleeding during birth. So during birth means it was already there. And persistent tachypnea for several days. So several days means during the birth. So it means the child came to this world with infection. So that's a paraphrase form of it. So straight away pointing that it is A. Now let's see. The infection surfaced itself when the child turns 1 year and 6 months. So surface itself means it automatically came at that spur of the moment when the child turned 1 year and 6 months. It is saying at 1 year and 6 months still excreting. That means it was still there. The CMV, which one? The cytomegalovirus was still there. So that means the child had infection already. So it's not just when the child turned 1 year and 6 months. No, that's a straight eliminator. This is how you refer. See, the most of the answer why you're getting it wrong is because you're referring with the keywords. See, keywords are not the answers. Okay. Now, the child was normal at the age of 1 year and 6 months. That's again something which is not at all saying that at the age of 1 year. See, had normal, they are saying even at when they were checking 1 year and 6 months, he had normal neurological development for his age and his sight, hearing, examination findings were normal. So it's not saying that the child was normal. These signs, other signs except for these infection. So the child was not normal because the child was carrying infection. Understood? So B and C are a straight eliminator, and the answer today's question is A, which majority of you have got. Now, what is SNAPPE? How many of you know what is the abbreviated form or what is the full form of it? I know that most of you would know, but just to make sure that I'm just making sure that you are using all those things that you have, if you have forgotten. How many of you know the abbreviation of SNAPPE? Keep on dancing, Anju. Keep on dancing. And who's the other person? Ambili. Shruti, thank you. Namita today. Little bit late. Good afternoon. No worries. It's always better late than never, isn't it? Soumya Shijo. Now she's dancing a lot. Good enough. Keep on. Rakshit Shetty. Just not clear. Okay, fair enough. Now, how many of you know the abbreviation of SNAPPE? Tell me. If not, I'll tell you. That is why we are here, isn't it? If you don't know, we are here to give you that. If you know, we'll be happy. Revati is saying thank you. Pleasure. Vidya clear. Excellent. Now, anybody know? Anu, Anil, do not worry. We are here to learn. So, learning is a process, it's a continuous process. Don't know. Okay, fair enough. See, SNAPPE is score for neonatal acute physiology with perinatal extension. Okay, so again, I'm repeating score for neonatal acute physiology with perinatal extension. So I hope you learned three things: SNAP, Petitia, CMV. Excellent. So as you have all dealt with it, and I always believe the most important thing of learning is accepting. So as you have already accepted that you don't know, I'm so happy with it. Yes, Lieber, that's the absolute meaning of it. Good enough, good enough. So I told you there are people who know that, there are people who doesn't know. We are not, see, we are considered as human beings, isn't it? Where we are learning. Every day you learn something. That's the whole ideology behind Neethus Academy. Every day we want to make sure that you are learning something new. Or even if you know something and you are giving a new insight about it, be happy with it. So that wraps up today's part B. Now, are you all ready for today's part A? Give me some insights about how did you find today's material and what is today's material. Let me see how you are feeling of what Neethu madam I've given to you. So what is today's material? Part A. All of you have done? I hope all of you have done, yeah? Yes? I'm sure. Part A, C-section, confused and tricky material. Just now, fair enough. Neethu Srinivasan, C-section. I want your insight. Keep on pumping me with all your insight. Ready, Lisa? Fair enough. Very ready. Okay, fair enough. Jobia is saying C-section. No, I want that insight. How did you feel about today's material? Tell me a good material. Okay, fair enough. I like it. Done C-section. Easy, Liba. Good. So it's a mix of it, isn't it? Tricky, confused, easy. Part A. Okay. How did you find? Was it easy? Piece of cake? Challenging, difficult, 50-50? Took more than 15 minutes. Okay, fair enough. Shanila is saying tricky. Easily, yeah? Okay, it's a mix of easy, tricky, confused, and all those things. Okay, fair enough. Average judge, okay. Okay, I'm believing. Go ahead. Right. Now let's go and dig in and get those 20 answers. Yeah. All of you ready? I need lots of time. Take, because we are practicing, isn't it? So every time when you are beneath or challenging, I don't know. Every time when you're Jackson Joe's a familiar topic. Okay, fair enough. Every time when you do it, what do you do? Today I've taken 15 minutes, tomorrow try to bring it down. You push yourself, you challenge yourself, not to anybody else. Rekha Manu is ready. All right, as you have said, it is ready. Let's go into 1 to 7 questions, which is called match the following. And again, skimming scanning is the keyword. And after that, you have to refer with the keyword. So you have to underline the question also. So clearly, the question number 1 is activities that you are unlikely doing just after a cesarean or C-section or section. So what are the things that you're not supposed to? So activities are as such mentioned. If you really look into in text B, it clearly says ask your healthcare provider when you can expect during recovery. Most provider recommend avoiding steps, lifting exercise and other strenuous activities. So the answer to question 1 is B. See, Rakshit, please understand, students are always there. They are always telling on the aspect of a lot of different things. Okay. So what you have to always look into is, yeah, take it, learn from this. See, when they tell you something, don't get panic over it. If they are giving paraphrase, be ready for it. On how would you be ready for it? Do the material more and see, do more challenging ones. Okay. They were telling even idea of the paragraph was paraphrase. Let it be, because if you are see, if you have a reading habit and if you can comprehend as what you read, these things are not going to be a problem. Understood? So students will tell you should know what you should be taking and how you should be prepared. So don't worry about it. Question number 2. The steps that are initially followed till the cut is made. What are the steps? So initial cut is made. So where are they talking? Your abdomen will be clean with an antiseptic, and then you might have an oxygen mask placed over your mouth and nose to increase and oxygen to your baby. You provide place sterile drape around the incision site, over your legs and chest. Finally, a sterile curtain or a drape between your head and your lower body. So those are the steps. So where are they talking about? Is as such mentioned in the second paragraph of D. Question 3. Instances that may compel, so keyword compel one to have a cesarean section than normal delivery. So where are they talking about instances? So if we really look into the flow chart, clearly said why it can be there. So clinical signs and all those things, whether it is needed, is there in text C. So the answer to the question 3 is C. Question 4. The sedative that cause numbness but be conscious during the entire procedure. So where are they talking that you're given a sedative but you're still remembering everything? So it's as such mentioned in text D again. If you really look into the first paragraph, most planned C-section uses an epidural, so you're awake for the delivery. So in some cases, you're asleep under general anesthesia. So the answer is D. Question 5. Why is it necessary to have someone assisting you post to a C-section after? So necessary someone assisting C-section. Why? Because it clearly says you might also experience, see, whereas you'll begin to feel the pain from the incision, you might also experience gas, pain, and have trouble taking deep breath. Make sure an adult is there to help you to get up from the bed for several days. So the answer is B. Question 6. The usual time taken for conducting a normal C-section. So usual time conducting C-section, where are they talking about? Text A. The typical C-section takes about 45 minutes from the start to finish. So the answer is A. What is the significance of the past C-section details? So why is it important to know about your previous history? It's, of course, it's there in the chart again. The graph, the flow chart will give you. So the answer is C. So that wraps up 1 to 7. So please be kind enough to tell me what is your total score out of 7. And in the meantime, let's go into 8 to 14, which is called short answer question, where you're expected to write a word, a number, a combination of both, or a short phrase. So what is being administered as the initial phase of C-section where the patient is aware of? So we know that we have already read that, where in text D, the answer is an epidural. You can, with or without the article is fine. The answer is epidural. All the keywords are as such mentioned. Question 9. Once the instance of smooth progress of labor is perceived, then it is better not to suggest that. So when that smooth labor is there, you're not expected to suggest. So routine uterine exploration is not recommended. Where do you get that? And the last point, when the smooth labor progress, as such mentioned in the flow chart. So what is not recommended? Routine uterine exploration is a 3-word answer. ROUTINE UTERINE EXPLORATION. Question 10. Who are allocated to perform C-section? Obstetricians. So where do you get that? You get that in text D. That's the only people who perform C-section. The obstetrician will then make an incision. So OBSTETRICIAN. Question 11. Maximum prolongation to which bleeding lasts subsequent to the surgery. So maximum means, what is the maximum? So the answer is 6 weeks. Where do you get these 6 weeks from? You get that in text B. You can expect cramping and bleeding for up to 6 weeks. So maximum is the question. So not up to 6 weeks. Maximum is 6 weeks. Now, question 12. History of which condition may insist us to go for an elective delivery on the 38th week of pregnancy? So very specifically saying condition may insist. So you are asked to find a condition. So previous history of classical scar or hysterectomy scar. It's there again in the flow chart. We'll ask you to go for C-section. 30th week of pregnancy. Elective delivery of 30th week. So classical scar slash hysterectomy scar. Anything is a possible answer. Question 13. The condition that might notice in babies who are delivered through a C-section. So what is the condition? So condition is being asked. So condition is mentioned where? It is as such mentioned in, where do you get that? You get the answer from, the answer is breathing problems, and you get that from the very last sentence of text A. Your baby may have trouble breastfeeding. That's not a condition. Your baby may have a greater risk of breathing problems. So that is the condition there. So the answer is breathing problems. 2-word answer. Question 14. What is being peeled off post-surgery that eventually comes out through your vagina as lochia? So clearly peeled off post-surgery, comes out vagina, lochia. Lochia is the most important keyword. Where is it talking about lochia? It is there in text B, the very last paragraph. You will also have a vaginal discharge after the surgery due to the shedding of your uterine lining. So what is the thing? Uterine lining. UTERINELINING. So that wraps up short answer question. Now for the final stint of fill in the blanks, where you're expected to write a word, number, combination of both, or a short phrase. So question 15. If the dash is adequate for the baby, then it is possible to have a vaginal birth after cesarean. So what is the thing which is adequate? Adequate means which is good enough. So they are talking about, in the chart, it clearly says pelvis is adequate for the baby. So what is adequate? Pelvis. So PELVIS is the answer. Question 16. Dash is removed following the cut of the umbilical cord once the baby is taken out through the incision by the obstetrician. So what is the thing? So they are clearly saying again in text, the umbilical cord, keyword to refer, is cut, the placenta is removed, and the incisions are closed with stitches and staples. So what is removed? Placenta, Placenta. Question 17. Taking steps, lifting, exercise, or dance that are asked to avoid by a person recently undergone C-section. So you have, okay, and I've read it. Where did I read? I read it in text B. Now what is that? Strenuous activities. Strenuous, ACTIVITIES is the answer. Question 18. As a risk following C-section and dash will break off a clot formed and getting entered into the bloodstream. So where is it talking about bloodstream, clot, and all those things? It's there in text there. We really look into in that lot of points which is mentioned. They might include a blood clot that may break off and enter your bloodstream. What is that? Embolism. EMBOLISM. Excellent. The penultimate one for today. After being hospitalized at 36 weeks of pregnancy, an elective surgery is conducted after dash weeks. So now this is a bit, it's not as such, isn't it? So hospitalization at 36 weeks. Now where do you get that? You get that in the flow chart. Or I'm sorry, the flow chart, yeah. So next to that, elective surgery of 38 weeks. So 38, 36. So if you minus the 38 of 36, how many weeks? 2 weeks is the answer. Not 38. The answer is 2. Because you're there already 36. And what is the 38th week elective delivery? 38. So how many weeks you have to wait? 2 weeks. 2 is the answer. Okay, fine. Ultimate one for today. So what is it? Cut is made through the skin, which is vertically, and opposite one is also known as. So what is it also known as is the question. So what is it also known as? It's also known as the bikini incision. See now, why didn't you write incision? Why only bikini? Is it mentioned in the question as such? Is incision mentioned in the question as such? An incision is mentioned, so bikini only is okay. Okay, bikini is the right answer, is known as bikini. Or if you have written bikini incision, can be for just in this, because the question is not framed. See, when the word is there as such mentioned in the question, then you really don't need to write that. Okay, it's known as bikini. Fair enough. Now I have finished all the 20 answers. Now it's high time that you start firing me. What are your total scores? And if you have any doubt with regards to any of the questions. Any doubts with regards to any of the questions? Yes, do you have any doubts? No? How many have we got? Okay, Sanila 18, excellent, good enough. Sonia is 18, excellent, good enough. Shruti is 19, very good, keep it up. Sophia 6 out of 5, okay. Albi Maria 19, excellent, keep it up. Good. Very good. Ambili is 17, good enough, keep it up. Neethu Binoy is 19, excellent, good enough. Liba Libin is 18, very good, keep it up. Good. Soumya Shijo, so happy after 2 days I got 20. Very good, Soumya, keep it up, keep on dancing. Yes, make sure that you enjoy the achievements that you're making. Horizontal incision is known as bikini and they are asked for transfers, right? No, the question is or the other one. So the other one is known as, yeah, so it is bikini. But I like when you are asking doubts, no problem, okay? But good enough, Achu, good enough. 18, keep it up. Anju, sorry. Okay, is there any general doubts that you want me to clarify? Anything that you're unaware of, anything that you want me to clarify, anything like that? I'm sure that you're all tremendous students with an absolute ability to make sure that you clear this. Soumya, thank you so much. Abhi, thank you. Vinitha, Reno 15. Anju understood. Okay, fair enough. Good, good, good. So as you have started saying thank you, I would definitely say on behalf of Neethu's Academy, a big thanks to all of you for giving us all the lovely support that you've been doing and you are doing and you will keep on doing. So thank you for that and do not forget to share this. Until I see you tomorrow, adios from me. God bless you all. Take care.